Hi, I'm Dr. Tom McGovern, the Mohs surgeon with Fort Wayne Dermatology Consultants. I've been practicing here since January 2000 and have performed over 15,000 cases of Mohs surgery, predominantly on cancers on patients' faces. With Mohs surgery, I'm both the surgeon and the pathologist, and this method gives the highest cure rate for skin cancers, particularly those located where tissue conservation is important, such as the eyelids, lips, nose, and ears. All cases of Mohs surgery are performed while you are in the office using local anesthetic. When you come in, please plan your day around surgery and don't plan anything afterwards, particularly anything that requires exertion. When you come to the office, one of my nurses will bring you back into one of our rooms, like the room I am in right now. My nurse will lay you down and numb up the area using an injection. I will then come in the room and, using as little tissue as possible, remove your cancer. My nurse will then stop your bleeding, put a bandage on it, and you'll go to the next room where there's a waiting area that includes food, drink, and things to read. While you're waiting, I'll take each piece of tissue, cut it in half or more pieces, mark it with 2 colors of ink, and draw a map of it so that under the microscope later I'll know what was up, down, front, back, or left and right on you. Then I'll hand that tissue across the hall to our lab, where I have an assistant who will make microscope slides. When I look under the microscope, I will see all the edges and bottom of what I just removed from you. If there are any cancer cells remaining at the edges or bottom, I'll know exactly where they remain on you, and we'll bring you back into a room, lay you down, and make sure the area is numb. I will then cut out another sliver of skin only where cancer remains. Then I'll take that tissue across the hall, and we'll make slides again, and I'll check it under the microscope. I repeat that until the cancer's gone. 40% of the time I get it all out with the first cut. 40% of the time it takes 2 cuts, and 20% of the time it takes 3 or more. When it's all gone, my nurse will bring you back into one of these procedure rooms. I will discuss with you how to repair the wound or how to take care of it as it heals on its own. About 1 in 6 wounds will heal on their own without stitches. I will see you back 3 weeks after surgery to check on the healing, and you'll get detailed information in writing and verbally on how to take care of it. The other 5 out of 6 wounds are repaired. About 2 out of 3 are repaired side to side in a straight or slightly curved line using 2 layers of stitches. About 1 out of 6 wounds is repaired with what's called a flap. That's where I have to make a series of curved cuts so that I can rearrange the skin like puzzle pieces and put it back together so that the area looks normal. That's necessary on areas where there is little skin to use, such as the nose, lips, or ears. When I operate on the face or neck, I use stitches that dissolve, so you don't have to come back to have stitches removed. The stitches on top of the skin dissolve in 7 to 10 days, and the stitches under the surface dissolve in about 2 months. For areas of thicker skin, such as the scalp, the back, the arms, and the legs, I use stitches on the surface that will be removed 7 to 14 days after surgery, while the stitches under the skin will still dissolve in about 2 months. The chance of your cancer coming back again in the same spot within 5 years is 1% if that cancer has never been treated before. If the cancer has been treated before, there is a 5% chance that it will return in the same location within 5 years. That is still better than any other method for treating skin cancer. About 1 in 25 patients are referred to a plastic surgeon for repair. That happens when a wound gets larger than I anticipated and is beyond my abilities to repair. I have a good relationship with local plastic surgeons who I have worked with for 15 years and do an excellent job. Our office will do everything to set that up for you when necessary. The risks to you the week after surgery include a 2% chance of infection. I'd give you an antibiotic if that happened. There's also about a 2% chance of bleeding that takes more than a little pressure to stop, and our instructions will tell you to hold firm pressure for 10 to 20 minutes on that area. While scarring of some sort is unavoidable, I do everything I can so that the scar remains as hidden as possible. During follow-up visits, there are several things that I can do or recommend that you do to improve the appearance of any scar. Pain is typically controlled by over-the-counter painkillers such as Tylenol, Motrin, Advil, Aleve, or their generic equivalents. If I am operating on the nose or other areas where there might be significant tension, I may give you a prescription for a stronger narcotic painkiller. You will receive instructions on how to care for your wound when you leave. It will include my home and cell phone numbers should you need to get me in an emergency. If I use dissolving stitches on you, I will have you schedule an appointment 4 weeks after surgery so I can check the healing. However, if you are satisfied with your healing at 4 weeks, you will be eligible to cancel that appointment. On the morning of surgery, please eat a good breakfast and take all of your normal morning medications. Also, please wear a button-down shirt so that you don't have to take a shirt with a small collar off over a bandage that's on your face. I ask that when you come in, you refrain from wearing cologne, perfume, scented body lotion, or strongly scented deodorants. I am sensitive to fragrances and it makes it difficult for me to concentrate while I am operating. We ask that if you have stitches, that you refrain from straining during the week after surgery. Straining means holding your breath and pushing, like you're lifting something heavy. When you do that, it forces more pressure into your face particularly and can pull apart stitches or cause bleeding. If I'm operating on your legs, I will ask you to bring a pair of support stockings, and my nurse over the telephone will tell you what kind to bring. This will greatly assist the healing for your wound. If after viewing this video and talking to my nurse on the telephone, you still have further questions, you may set up an appointment to talk to me in person on a day prior to surgery. Otherwise, I look forward to meeting you on the day of surgery and taking care of your skin cancer for you.